Hi, I'm Dr. Kit Weathers, and it's time for the Root Tip of the Week. But let's begin with the illusion of the week. With this week's magic trick, I'll show you how you can make very small items appear suddenly and then disappear just as quickly. To learn the secret to this and other magic tricks on this series, please go to EndoRootCamp.com. Computerized digital imaging systems. We're getting bombarded from every direction with different companies, different ideas, different sensors, phosphorus versus non-phosphorus versus wireless sensors. We use DEXIS here at LVI, and I actually used it in my practice before coming here. And I like it for a couple of reasons, and DEXIS also. The quality of the images are terrific. The reliability of the systems is very good, and it's quite easy to use compared to some of the other systems. Since we have people coming from all over the world here, we don't want to have an X-ray that doesn't work or a software system that doesn't work when somebody needs a picture. So, we already talked a little bit about the phosphorus plate versus the direct sensor. And again, advantages, you handle it just like film. Disadvantages, same thing. So the basic system I like are the ones that take it directly into the computer, where you have your standard X-ray head. You don't have to replace that. You put the sensor in the patient's mouth, it receives imaging, goes down the wire, shows up in the computer in about 4 seconds. Would you like to try to diagnose from a little tiny X-ray, as we see in the upper left-hand corner, held up to the light, or possibly a full screen version of the picture you just took? And you can write things on it. You can put arrows and point to these root canals that are a little bit too short. And all of that stuff can be removed. It's not part of the image. Let's say you're looking for a decay and you take an X-ray and you look at it and you say, well, I think that decay might be into the nerve, but I can't really tell for sure. I don't know if it's possibly going a little past that. But you can artificially enhance the edge sharpness by pushing a button which incorporates an algorithm. And on DEXIS it's called Clearview, and this is what it looks like. And now you've got a much better outline of where that decay is. If you have a film that's too light with regular films, you're pretty much done. You've got to shoot it again. With digital imaging, you didn't take one picture, you took 64. 32 shades lighter and 32 shades darker. So you can just adjust that image so you can see a whole lot better what's going on. It's rare that you'll have an image that's not legible, that you can't read. Here are the advantages in Endo. It saves you a lot of time because you can, in 4 seconds, you can get that image. Quick retakes. Anybody in here ever cone cut an X-ray? Did you ever cone cut the one after that and the one after that on the same patient because it looked right every single time you put the X-ray head up there? With the digital imaging, you cone cut it, you look at it and say, oh, that needed to be over here. Take another picture. 4 seconds later, you've replaced the first one. Patient explanations, it's a whole lot easier to point to that large screen and talk to the patient than it is to just look at a small X-ray film. Multiple pre-op images, it's a good idea to have 2 images on every tooth. I don't think it's a good idea. I think it ought to be the law. I think it ought to be standard of care. Take 1 perpendicular shot and 1 shot from the mesial on every tooth you treat, except the upper molar, and that second shot should be from the distal. The reason we go from the distal on the upper molar is because a perpendicular shot shows you all 3 of the roots. A distal shot is going to superimpose 2 of the canals, but you will not see the 2 canals in the mesial root unless you go from the mesial. Single visit endo, it's a must for that, and you get improved file viewing in the positive mode, and we showed you an example of that earlier. Image enhancement. The thing I like about it, if you take a picture and you don't like it, it's not quite sharp enough, enhance it. Make it sharper with Clearview. Or you can push another button and reverse the image, and once again, there are the fibers, there's periodontal ligament. This is the relief button. It's almost a 3D view, especially if you've got root canal filling material in there. It looks rounded, and where it's thin, it's not as dense, so it looks like it's just jumping out at you. Color is great, too. When you push that color button, this is absolutely useless. But the patients love it, and you always want to push the color button. and change the color. Reverse the image. Hit reverse, and the colors change. And they flip around. It's almost psychedelic. And you can talk to the patient and say, look, you see that green stuff in the middle of that tooth? Look there. It's leaking out into the bone. It's all over the place. Down toward the bottom, that green is mixing with the blue. And we know you mix green and blue, you get yellow. Yellow is pus. It's coming up there. And look between the teeth. There's some blood. Oh, this can't be good. So we have to get that. Just whatever you want to say. You can also measure and enhance the apex. You can make it larger. You can move that image around. You can draw on it. You can isolate certain areas, circle things on it. All these image tools you can use. And you can even measure the canal as we talked earlier. But the thing I like most about the DEXIS is this little sensor. The sensor has the corners cut off. And you may wonder, well, what's the advantage of that? And the advantage is it's much more comfortable to have that sensor in your mouth. You've all had x-rays where you bent the corner so it would slide in comfortably on the lower. You can't bend the corner of a sensor. But also on the back of it in that little round ball, that's where the electronics are. Many of the ultra-thin models, the electronics are around the periphery of the sensor. And that means that you lose real estate. You have a bigger sensor than you need to get a small image. With this one, it's smaller than a number 2, but it is using the entire frame reference, and if we need more space, we can move it. So you can use this one size on kids or adults. Well, that's it for another edition of the Root Tip of the Week. I'm Dr. Kit Weathers, and I will see you at the next Endo Root Camp.